China ye nyina be shia e wa sorry de. Na wia no nso ya ye health screening said ye di kan akan. A doctor for be wo ho nti wa benya kwan bi abra queens. Enwumre ye de rade ase efi se wo hu ye mobo ama ye be shia bie mu a oduyefo Ben Opoku Bediako ewo ye ntem. Ye mu bebre nim no. Efi se ye call ka meeting no o ma ye ni je pa. Minimie se nnenso Awurade nam ne so ebe kyerɛkyerɛ yɛn ama yɛni agye. Doctor ye ma wakɔ aba. Trinity for ye ma mo nyinaa ye da mo ase se mo nam mo modern mo so CB radio. Na wo mo ntimi ma no, they have the chance to listen. Sabre mo me mo mpaye na ye wie a ye jai ha ma Dr. Ben Opoku Bediako. Moma ye mo mpaye. Adi nyina sutumfo omada wase. Homeda dru se ya na bibia ye boko fefefe se ye pay attention a. Ki ebe hu se ye bra wawrade wo ben wo ma. Na wie mu nsakra ye kra no ya na enwanwa dodo. Ye da wase se da mu iwahwe ye nyina ye so de ya hyen wo home mu homeda mu. Nya yesro ne se wo mo nyama ye fa wo mo bra. Nanam wakwa so kyerɛkyerɛ sɛ deɛ wayɛ ne na wɔtwe nyinaa mu no na yɛho a woyɛ tumfo wama yɛn nso aso a yɛde betie ne yɛde ayɛ adwuma na ho aba yɛn mfaso yɛnim sɛ nnwumere nso wobɛhyira yɛn ɛno nti yɛgyaa wako ahyɛ wo nsa ne ɔbɛka ne ɔbɛyɛ guide him na anya sunsuansoɔ papa ɛwɔ yɛn so Kristo Yesu din mu nti amen.
Amen.
Dr. Ben, ye jai line as well.
Ami Rebecca medasipe and me say me ma
Me ba show ye until kasa ne papa.
okay. But after the Pamto after the multimenka.
Media meeting was loud and clear, mum.
Okay.
Doctor,
All
it
right.
I say who mute you but in volume ni wo fem.
Ye tipa wahene.
Minim say mo aka motia na.
Yeah, papa, akwandi betepa. Yeah.
Yeah, obi aso multimenka. Okay. And yeah, nyame ase. Me say Yako meeting about now, and we said this week we've been very educated. Thanks to so my main and Nimpenyon for Queen's Ghanaian SDA Church Health Ministries Department. And me person me fa kwenye so na me damase for the opportunity to be back here. Me say women ministry for mama ba and then so health ministries for me aba. And me say sinedi kan ye share nneɛma no bi ase wɔ meeting ɛna nnɛ yɛba aba bɛtoa so na ɛnɛ adeɛ a yɛba bɛbɛsua no it's a little bit ɛyɛ adeɛ a ɛfa obi ho and I will say this the reason in is one of my specialties is dealing with people with chronic pain na ɛyɛ adeɛ and I decided to do that because after practicing for almost 18 years, I realized that one of the biggest things I am obia complaining Michelle and is pain. And for me personally, me per se, I get more knowledge and I'm per se me what the pain is, so that so be a if I have to explain it. And I realize that even as healthcare clinicians, anyway, say no, when we have to explain pain to patients and ask them, I said. Your knowledge, and kwenimu kese. And for me, and I was a corporate of it, into me, my brain said I needed to have more knowledge and help my patient to understand the whole aspect of pain. Na eno sa nimdia na me pese ene ye fasa ekwan so na ye share that knowledge no. Into me share my screen na we will move on from there. Me try say maybe try your money be so na ayen temamaye because the whole aspect of pain, I would say is sometimes it can be a little bit complex. Now, the same me can a idea affect you na. Enti you better time kakra na ya try to explain it. Okay. Now, additioning an objective ni I say me be very academic, but the long and short of that one say you per se you hu idea say you pain na e den na you pain. Now, then kwan ben so na yebefa so. What are some of the reasoning behind it? And as you count the process of pain, and then you simply say who say kwan ben so na yebefa so na yetimi recover if we find ourselves in such a loop. And then how are you betimi so aboa na ye nua bi so no so e bia woni black this platform so wetimi anya sa knowledge ni bi. One of the things I'm a person mechanic say one, the difficulty is not creating new ideas but escaping from old ones. I say Otrefo John Keynes and the cancer assembly. Now the opportunity say most times and yes say idea be no for free na a hard dream. But a lot of us yeah, well, new maybe ya can't say a walk. Now sometimes see exercise is so difficult, and especially within our Ghanaian community, even church, crano because you can't see exercise. What there you see, I make a Queen's Church, me banner Sabbath, near I say okay Sabbath, you be the 9 o'clock, the divine service I shed 9 o'clock. Now you are yes about school. I mean, sure say most Ghanaian churches you back on to qua. And I'm a boy. But that is the truth. But it's not even about that. Most times the change is very difficult for most people because we have these ideas sometimes we've not been able to escape from it. But then let me per se, you need some concept we need to miss some of the name and how we look at pain. Now, one of the things and then say, we all agree say pain is just a universal human experience. You move beyond who I mean, you sure say, Obi will platform you so I want experience pain that. And I also wait to make say, onya pain that. Now, in the past decades, let me say, when it comes to clinical science, there's been a lot of advancement in it. But our advancement in research anyways has not translated to at least it's a practice. So far, like US, had no man. 1 in 4 people in the US will pain. Okay, Australia, 1 in 5. Meaning that pain is a global pandemic and everybody's experiencing it. But if that is the situation, I don't think there was so much of it. In fact, so over USA, you form 4.6% of the world population. But do you know that the US continue to consume about 80% of the world opioids? I mean, so be our have heard about the opioid pandemic. And the problem some big pharma and pharmaceuticals have been sued because of that. And 6% of the entire world population, but we are consuming 80%. In fact, they say, now we just 4% of a fee income. Now we will consume 80% of the resources. And say for every $100, we'll spend $8. Yeah, I Canadian for $2. I think that's a huge challenge. But unfortunately, that is the situation we find ourselves in the United States. Although say for me a very small portion of the world population, pan are they pain killers. Anyway, say no pa and also in so in terms of statistics, that is what is going on. I mean, per se, you better bother yourself so much with the statistics, so much. And by way of statistics, and that's it. But interestingly, we are spending a lot of money. A lot of your money, answer is sika. Nipa bebre ye adwuma na most of the adwuma na you use to identity to know. Especially painkillers in any form and everything. So the question is, why are we spending so much resources in trying to manage pain? Are there other ways? And I said, what are the things that we need to know about pain? We are spending so much resources on that. Now, one of the reasons, and then it's education has gotten to know that educating people about pain is one of the best ways for self-efficacy in people with chronic pain of any etiology. Meaning, say, no matter nipa no idea causing the pain, if people are educated, they really know how to manage themselves. Like they amount me who kind of mobile fast Emma sa pain I then aqua form. Me you see this example, say me sure say neighborhood a wo baby a yete say me catch us say driver wo say me fan say wo na ye yakura nka obetima driver o neighborhood. But say wo ko baby na wo nim area ho kese a me sure say ko come meeting obi or driver is wo ko ho wo driver we a little bit careful say bia wo nya obi a wo nim road na. But say we obi a wako ho no wako come meeting ho no ma driver ho no several times at least you are familiar with the road into one say o driving dynamics classes. But if you go into an environment where you don't know so much information and also affected, so the same way, even with pain, when you don't understand why you're experiencing certain pain, say me to say me elbow here, me yana me nim ni inti me elbow here, me ya, I'll be a little bit alarmed. Could it be this? Could it be that? But if I know the reason why I didn't know, I would not be so much bothered. And just that thought alone will influence how my pain is perceived. So per research anyway, say and I've decided say most of this my put on some of the research information too. You can screenshot it and you can read about some of this research extensively. Maybe we are interested at. But that is one of the things here. No matter the cause of the pain, that is the etiology. If you actually have knowledge about it, a boa my pain, esote. But like I mentioned, most of us, when we don't know what is going on, and that's the reason why we're pain. The first thing most of us do, is that we go to the internet. But your name said clinically, say misleading or inaccurate information, it poses more risk for medical conditions. Say we name now inaccurate information. There have been so many people on Kofa hospital. More wrong diagnosis. In fact, recently there was this Dr. Bia. I'm said the first and a chain because apparently or connive with this pharmaceutical companies no man for fake cancer diagnosis. No man chemo treat your man just because he was getting kickbacks. So imagine say more diagnosis now apparently it's not true. Now all this one why dream say what cancer now apparently say we need cancer. Now we who chemo no more anyway say for something that you don't even have. That is how misleading information can actually pose a threat to your life. And for most people, when we start experiencing any pain at any place, the first thing I hear and I say, you call Dr. Google. Like we see on my screen, and then we are trying to find out the cause of your pain. Now, one of the things that in my study, one of the things that we want to say, do you know, say only 10% of the information on the internet is relevant when it comes to medical conditions or like you talk about disc herniation. They did a study no more say when you talk about disc herniation evaluation of information on the internet, say my see when you're boarding disc be which casena you say one I atwafa home tweak some sound mekanum. Disc herniation, they realize say only 10% of information on the internet about this herniation is accurate. 10% per. But mostly, so BCC and where the first thing is to go to the internet and trying to find out all this information. So if that is the case, what can be done? But it is all because medical cancer. The problem is not with getting new ideas, but the problem is getting rid of old ones. Your outdated educational model, and I say a picture of what we've been made to believe, say how we can deal with problems and as a pain when they come. Now, so here me screen here, there was symptoms in the pathology. Pathology means say be a problem and you panel. Intimate say obi will shoulder pain. And only and I say shoulder problem and only pathology. Symptom no be the pain now experiencing. Over the years, what we were made to believe in and say as the symptom increases, to say baby I'm arrow equal air corner. Meaning said that means that the pathology is also getting worse. Meaning said over the years and what we're trained to believe in is say me more pain nature say me shoulder no see you see shoulder as an example. The more pain I experience in my shoulder, the worse the problem. That is the thinking at first, even those of us who went to school, medical school, went to the basic sciences, nursing, whatever professional, especially the health, that was the thinking, meaning that was the model, the pain gate theory, meaning the more pain you have, and the theory was that if you have more symptoms and then it means your pathology increases, meaning we put in an intervention bit say unumadrua, meaning say adrone ma pain ba from penetrate a problem na eso ayden ate mpamcho yate ase ekosi sabre.
Doctor.
Good. All right. Okay. So meaning member say pain ni meaning say bia mai ba me hu enti this too, meaning what we are trying to just to reiterate and say symptom no pain na me no pathology no shoulder injury na bia manya no. The idea say the more pain into me say initially na me pain year 1. See, me pain it drew verse 5. It means me pathology and I said the shoulder problem is getting worse. Into the pain it drew 5. No. In this me non paracetamol. Na se pain exotic from 5. Na baba be drew 1. Meaning the problem is wiring at it. That was what the thinking was. But later on, as CSU you realize and one of the professors, my mentor called Adrian Lowe, or more steady be. Now, what they realized in 2013, what they realized in NNSA, apparently, ubektimen you be an symptom was through, but the pathology no form. My example, may assure say will be a platform you saw, what or see the shoulder problem or pain when the shoulder. Or ma taking X-ray. In fact, one of my I've had several patients. You're taking X-ray and as a CT scan on both shoulders, and they realize the shoulder now more pain. No, the other shoulder now only pain. No, or much X-ray. No, problem there or your worse is baby or experiencing pain. No, and I'm their clinicians who be buried. In fact, we me taking X-ray and as a CT scan. Now we share X-ray now. We be saying the nipa where the ultiminante. Because from what you are seeing, and can you say any pano crampo ultimately a PB cratunity so because guys send a buguso because the X-ray and analysis CT scan report and answer what we are seeing, is terrible. And then you can also have Obia, and me sure say there are people on this platform wakwa yetwa X-ray CT scanner, you only pain. By hey, oh, so much problem meaning say the pathology a costro, but only the pain. May show some profile there, and will be once was so much pain by a quiet sitting you. Where's why you frustrated? What's I didn't say everything. Oh yeah, but you try X-ray, MRI, CT scan, yes, in your dang, and you. What 1 hour do body no soon say I didn't oh yeah, meaning say I come back to what we were talking about initially, this model now, meaning this model is wrong. Because this model was telling us the more pain I want, the more now problem say then it means it means it's a problem in bathroom. But now we've come to know people have more pain, but only pathology. Ni shoulder ni ya pan so beta X-ray, MRI, CT scan, so na hwenya den eni ho. Obi so ha owo problem kese pa so nsa na enye den enye ne ya. Meaning that is not how pain works. There's more to pain because so people or na say was so much pain na ye hwe na ene ya na ye say we dey say he's making it up. At first, as a clinician, most clinicians who do not have that background, that's why they tell we say a patient with no hydrogen crowd or PBB na or kakasa no enye ne ya. In fact, recently me hear veteran be na clinicians or I will be referring to myalgia parastatica. Myalgia and parastatic and femoral nerve, the anterior lateral, what we call the lateral cutaneous nerve, the femoral cutaneous nerve, about hip one or growing hormone, not about lateral side, the horn supply. Obi to say security officers like police officers when mobile belt in the norm de intuo ne nyoma na hyehyɛ wa over time yeah na put pressure on the nerve no the femoral nerve na for mo groin no na support mo lateral side no no as a no or a base in Germany why yes apparently was putting pressure no shall say or catch obi almost oboa x-rays and other things were not picking up until I went in and we started talking and I pointed it out was for 18 good years, I've been battling with this. So I was starting, they started even treating me for psychological stuff, giving me antipsychotic and other things. That is the point. Meaning said this is a very important subject and most people are suffering from it. Until what we are saying is there are people who may have awful looking MRIs but never experience pain, while others may have near pristine looking MRI but with excruciating pain and disability. Into Buha, the MRI, like I said, it looks very awful, but omuni pain. Kofa kaya ye nina nase ma amena ote kejetia nase ote alaba nase ote kantamanto. Etwa nyomano nepcha eswe nepcha nekon. The level of degeneration we say they want a corner or they are the swan man. But that person need pain. Obitiane concha bakasa crack nice. And so yen the concern or say me you. That is what this is trying to say. Meaning said there's more to this pain than meets the eye. Your time need to me try some rush it through because we have just barely another hour pay. So just getting to understand this whole concept about pain is so important for us, and it affects so many things. And then we've been told over the years, and that is why understanding and being on this platform and is so crucial. Because once you understand the whole thing, it makes you or helps you to make an informed decision about your own health and whatever pain that you are dealing with. And me person me rush it through kakra na me we say, once they realize that most people, when people are educated, about 45% of the needless medical tests and treatments are done away with. When people really know what is happening to them, they don't lose a lot of money on needless tests because but they realize that when people have pain education, they have 45% less use of medical tests and treatment. Because when you continue, all these needless tests. So we can have pain depending on your chronic pain, your acute pain, your subacute, your chronic pain. We're going to discuss those time briefly. But mostly, pain that is, within 24 hours, 48 hours, we say it's acute. A drusa between beyond that and then the first 1 week, you kind of say it's subacute. Pain that is lasting for about a month, 3 months, you kind of say a chronic pain. And those are just the simple definitions. Meet me at the ama. So I use this example like what my screen is. I said, what's the problem with pain? And I say it has a whole systemic effect. In fact, obi pain be mostly in blood pressure was wrong. Obi chronic pain be mostly or down. And I use this. I had to say a brand or Hanuma or can and I told to the TV. Say on your left, Momo right side, I think so. On maybe or my left side. Or to hear TV come in. Say Uba Hanam fans and fans out to hear TV and I say, baby, I would to hear presentation and I'm fans jata be a buavro. A bohu pet. Now, Nipanka or two no man uncle, like quietly, there's balance. Everything is so balanced. Once pain walk in, it shifts the balance. For instance, the heart. What's the heart rate as I say okay? Not only that, young the relationship. First, they have nice relationship with people around them. Because of pain, into why irritable, be a crebe na buofu. And you know, who will be so giant pen and day. Into Nipa no one and say, now I can't catch it, my miss Uncle Kambankuma. And then say, who cry in a bufu? But ideally, say, so pain affects your relationship. For instance, like our GI. When people have pain, once sometimes who pain, we am create me account. Okay, now we am show say that even affect your digestion or muscles. There's always imbalance because you are forced to use one body part than the other. So even your sleep, can first with that, but because of pain, say how kwa. Because you're trying to wonder. So it affects your sleep quality. We also know, say, if you are not sleeping very well, weight loss is a problem for you because anybody who doesn't sleep cannot lose weight. Sometimes people think that weight loss is just only exercise and diet. It's lack of sleep will also, and it also make the pain worse. So you have all this cycle go through when you have chronic pain. So what is less clear though is when we are told you have chronic pain, is knowing what's best to do, what to do about it. And they say, will be persistent pain, and also chronic pain. The problem in this say we are trying to find out what can I do about it. Then a bit my day, but to know what you so you bit my no. As a pain you who say persistent pain now is it the tissue problem or is it a brain problem? Or a brain problem, or a tissue problem. Now, as we go along, maybe our question is nipa ne pain now or experience na, is it coming from the tissue or is it coming from oversensitive brain? And that is why this is so important as we go along. So, obi our chronic pain, you have persistent pain, like pain or chronic pain. And let's define what pain is. Now, I say, baby, I will be able to screenshot this and also to take a picture. Take it. It was a definition done by Mosley and his friends. Say pain is a multi-system output. Now, maybe I can't talk maybe I may try some muchino. Or see, pain is a multiple system output activated by an individual's specific pain neural signature. The neural signature is activated whenever the brain concludes that the body tissues are in danger and action is required. That is the classic or clinical definition of pain. And the idea picking up from this definition, and say, so we image here what meaning say pain is a multi-systemic output, meaning say pain in your idea back. Your systems, it can be your neural system, musculoskeletal system, gastrointestinal, all of endocrine system. And your systems bring it out an output. Now output if a specific pain neural signature is activated. Into I say, what to 1 hour TV doom now waso. Offer remote no now so activate TV no say anything. And so NASA activation it only activates when the brain and I say brain way conclude they say your body and I say a particular tissue is in danger and action is required. Enti I say yes say bibi ango ka papa nye den grade and I'm penny for say yes sa na beneti emeboa. Enti say bibi ango kana the only time my pain is activated so pain is kind of like a messenger on the or the baby say na sumana eno oba no aba ka che say ade we na ekoso. So anytime you experience pain, it is a messenger telling you that there's a danger or there's a problem somewhere within your body tissues and you need your action. It needs your intervention. And that is basically what pain is. Pain is just a messenger. And me person me repeat it. Pain is what? It's a messenger. Na ya kan mamu no yesi se na nasoma messenger sabi ni oboda wuro na ya mboro no
messenger.
Macho ya tia say pain is a messenger Ono no de oba be ka kire say bibi eye den esi na me pese wo ye bibi eden efa ho brain no o brain no na e ka kire wo say bibi esi wo ha na ye pese wo ye bibi eden efa ho. But the problem with most of us in say messenger ne ba ye dwin say messenger ne na ye problem on the osonkra wo ha ene ya ka kire say o ma me o Ghana no yare ene obi a den afre wabo amane ukoko utwa ukoko apai aden na wabebo amane nti ono messenger na obuafu no. But the problem they say o catch the messenger they say omia na no a it does not take away the fact that say o ma me yare nti ubetimi aso na no e de akata na no, but it doesn't take away the fact that say o ma me yare e yare nti ubetimi abribe no say enka nkere me say ma me yare okay no omia na no ni asoma another person aba o ma me yare osimia wa no sa na emu bi ye. When the pain comes and instead of dealing with actually the root cause of it, now you know painkillers need to numb the messenger. But it does not take away the problem now. And don't think will be or painkiller no pain be reduced, but the pathology now is not gone yet. Anything that's one go into a loop or no pain now or doing painkiller now okay. In this I didn't say crampa. No agusu no yeden or you thinking say problem in you because pain in you be into over time will be you so base ade na ayeketwa na ayede ayekese. In a simple term, me yusu ye move bebre yusu car, me yusu check engine light. Pain is just like a check engine light. But that dashboard also. The problem is not the check engine light. The problem is that the check engine light in a car say there's a problem. Ewo car no ma check engine light alert to send be a uba kwa kwhwe at the kron no aye there was over. But send an affairs in the Ghana you will be a quiet say oh you check engine light in if you we say no ama mechanic no atwetwe wires bi no atwetwa wires bi ndi atwa wire no we say ekọ nti na teze na somadwo ni obehu an say onam kwa no sisa na ni inji abo na abusuafo enode hu ane ena mabusuafo na eye me na all the kwan mu say na ka beja me kwan sa na tie. When the signals start coming and we just cut off either through surgeries or other things, you know, sometimes people will go do surgery but they have poor outcomes because the thinking was when you cut off the wire now then the signal no more be there, so the problem is solved. So I didn't sorry signal anybody I cut it, but the problem have not been solved. Until sometimes people will do back surgeries, do shoulder surgeries, but they are still having pain because pain is what? A multi-system output. And yet a system. So you just took one and then you left out the rest, and the others also do the heading. Eba. Mpamcho say I hope say mbetimi atsire mu kakra. Minim say questions. Aha. Na ese ye also hu ne say ye brain no. Ye were 9 board members. Ewo ho a omo na ye responsible for pain. Say ko ye brain na me can say pain is a multi-system output. Na say eko brain ma information na board members na omo decide say yen activate wo neural signature na say yen activate signal pain signal no omo ye nipa 9 board members 9 and ewo brain no omo na yes adwuma no enti nyankopon God in his own wisdom senka ye wo access to your brain in that part nka ye mu bebre nka ye be cause adwuni nka ye yi sa part na free ho. But God in his own wisdom, it is not easy for you to go and take care of all of that. Without and pain is a necessary evil because without that, and my example, my cousin, I an oncology nurse, and then now she's gone into trauma nurse. Now, can sorry be sharing me? University of Maryland Medical Center trauma. Also, be a nursing station almost na. Once the cameras were once or more lobby hold on the nursing station. Now, Obi Babeshe na down for Yajana to hospital. Quick story. Now, down for Naja hospital or Baba Besheno. Now, Nippano, I'm say opioid, I'm say drug overdose, ne dose or honum. na nadamfo na ọba abɛhwɛ no ɔmo nim sɛ ɔnante saa ɛba nation station or nation station no ɔmo ehu sɛ ne nan ne kotodwe no efiri ne kotodwe no ne nan na adrop off te sɛ obi ɔhyɛ prosthesis na asɛ ayi ne ayi no ɛnyɛ obi ɔhyɛ prosthesis o wayɛ opioid ne saa fentanyl na to de sɛ ɛdidi na ayi nanti no saa ne nan no sɛ bio menim sɛ yɛmu bi yɛdidi yɛ nkyɛ ne nan na pro. And now, once I said those drugs and fentanyl, it numbs your nerve. Into on tissue, into sa didiama when you are didn't go to Jenna into one man and the go to Jenna just drop off just like that. Believe it or not. And when she showed me the picture and the video, I'm like, yes. That is the importance of pain because it allows us to know something and do something about the problem. Now, some 9 areas now will brain quickly. Yeah, well, premotor cortex. Me person, you don't need to know that, but me person will say you have 9 areas. One of them is organize and prepare movement. And he said, once say when you're pain, movement at that area no is what affected. You don't want to move it because that part of the brain will activate the premotor cortex and the motor cortex and rearrange the place as a way of protection. Then we have what they call the cingulate cortex and no concentration and focusing. But it's nothing beyond what doing here then. Focus they be at the corner heading. Then you have the prefrontal cortex, problem solving memory. They be an dream. Okay. But just what I say. And then you are trying to find a place. Then we have the amygdala. It heightens and only are responsible for fear or fear conditioning, addiction. That is the part of the brain. When say that part of the brain it get heightened. So people with chronic pain, or part of the brain called the amygdala is always heightened. They are always fearful. When say so, we was praying no, I do chronic side now. Hey, what they send from Africa fan and San Juan? No, I ain't. Wa jampe. Obian fan and San Caio, but what they found Sakra say. What so I say? No, move to try to protect that part. You ask yourself why. Men fam and San Caio. I didn't know with me then. A move. You bet me call all those sensory discrimination to sometimes catch and say a half an hour ya make I Ghana those times na you can't say Ghana ni bano but half an hour say me hunam baby or me hunim na because there's that sensory cortex what we call sensory discrimination. The body need maximize the thing to me. I didn't know a do chronic time and I can say today say nipa need pinpoint it where exactly heading. In fact, in solving chronic pain, your ability to narrow to the place your panel is 50% through the problem. Most people cannot localize where the pain is coming from. And then we have the hypothalamus and the thalamus, which talks about stress response, motivation. But only motivation, so the baby, the cerebellum, which is movement and coordination, they are not able to coordinate all of that. We can go on and then all this. So long story short, these are the 9 areas that are responsible for pain. So you realize that pain is more complex than and then you have all those experiences into so people pain and I watch it home no and you know. And that is why this education is also important so that when we have somebody like that or with fear, we will understand them, the stress and the things that they are going through. And the brain has maximized the whole problem. No, but me person take this image for example. How do nerves work? For instance, you have 45 miles of nerves spread across your body. And the brain now you can't no. Sa brain way, your spinal cord. Your spinal cord is an extension of the brain. Then you have branches. Na it be your brachial plexus, your sacral plexus, your femoral ones. Now, when say I had to say pampro, na wo say na branches na upon one sanity. We have 45 miles of nerves spread across our body. Now, Debbie, I can say 45 miles of nerves, and what they do, and they say. Anytime, your intelligence, gather information all around your body to breed the brain so that it can protect you. Anything I say, baby, can we call chromatic crana with me feeling? because you have nerves a carry me fan say Ghana cats those time because or yet almost sorry konkonsa aha yeah 4 to 5 months of konkonsa for me kind of on your body and to be information be normal then they call kokromoti say no ye wahanom nanso say no ye waha. It is just an information about the here to protect you. Now, for instance, some fans say Branty with 45 miles with BB Sua. Before pain, what do you need to know? I had to say, fire alarm and I say sensors will fear. One says, sensors never fear. And fan say smoke detectors never fear. Oh, how about you say any day, any juma and ameboa? Would you say about okay? But with them, we see being more corona, we say bad day. Especially near a battery, you will say in the middle of the night, na a China, was a war would die, was sorry. Sanity, these nerves are around you gathering information. When something has not happened, audience say anyhow. But be pet. So at this point, saying I had to say fire alarm. They are firing. To say before pain, they are firing here. And then because they are firing here, you have so much room for activity. But if there's a problem, then this firing rate now it jumps up and goes all the way to the top here. But what I say, into we say, Adena is so sensitive now, jumpy. Now a jump here. Most of us say through this level now, I am very sensitive now. Because there's a problem, no. The alarm na no. Normally me can say a burglary effect. My example view. Say yes in near waka no so. This are the way my meti ase per year. Say yes in penifos in your waka no so. I didn't hear. Yes, who be paying. Ain't now are you way so or did ne ban way in any aton chain ameboa. Say bibi sa yowa. So be fan say you're breaking into your house there. Once I would that cramp de piano, person making sure say door no yatutum, windows yatutum anyway. Obi a onya sa experience no antiase or because you are being paranoid. Sana body here. When you have a bad experience, your brain always keep a score. But I say, it always keep a score of what is happening. And to be frank, say BBC say CNN, the alarm system need become extra sensitive. And to people now I know until say this is the firing level. This is the normal electrical level. And to no drone pe we say adena ekosro ono drone pe na eswate kakra bi. Until say na baba say ha. And nam saying na we so obi wo ha so me no drone ko but me ye bibi kakra bi pe na esan me ya because you've not done anything to solve the problem. What ti animu ni kake. And first in the baby and no room for activity, you don't. Now the slightest thing, you are getting the pain coming back because you've not actually solved the problem. You already just reduced the sensitivity. And for most of us, it's a BB, and that's what is needed to drop the pain back to its normal electrical level, no, or the nerves to its normal electrical level. No? We don't. Yet the neuron na yatete something no, it was a sensitivity no. Aba form the nerve no sensitivity na aba form. Into ye bibi kakra bi na san yeden. I jump back to the extra sensitive areas. So this is just a very simple illustration. So simple put, pain is 100% produced by the brain. Sometimes when can say it's in your head. Yes, your brain is in your head. But and yes, and microphone is here then. I cannot say as if said you are making it up. No, it is coming from your brain, and there's a reason why. So, what can we? I'm a person but so how do people get extra sensitive nervous system? Emma hormone to be kakra be say almost show that now becomes a problem. Essentially from crabrim. And I'm going to rush through it. I'm just going to try to see if the next 5 minutes maybe now Mami Rebecca na yet maybe some question because and your man also. So that we can ask some questions. But essentially from crabrim. And I'm glad to say your parents were. Some of the reason people get into chronic pain is not because and then you show that now they've been bottling up things, and now man baby drew na cap na ye man me fan say me use water bottle. Ofri nkurabere na adisa ase ne nerve no aye extra sensitive kakra na baby drew ne. Enti ene banko kakra na otwi ye na ka ne kuru aye ma ena ene sisi aye dey ebu so. But ya tia say. Enti se okwa na wo de kwose no nkwa na wiye no nkwa afiri wa. When the pain is not going because there are so many things that are filling the person's cup. If you don't empty that cup as much as possible, just that one alone will not take away their pain. And you cannot surgery. Yes, surgery, you just dealt with one aspect of it. You've not dealt with the other aspect. For instance, childhood trauma. We've seen childhood trauma in people's marriages, in people's how they relate with people and all those things. It's because of some of the bad experiences an emotionally unsafe environment from the brain traumatize their brain even from childhood. And in a nutshell, say you're traumatizing a ma and all those things through abuse, casa, anyway, say bear in mind, pain is not just a tissue problem. It's a nerve problem. It can be that. And sometimes you can have problem just say yes, and our experiencing pain. That is a tissue problem. But for some people, their entire nervous system has been ranked up just because of this experience. Childhood traumas. Me pese quickly because health experiences. Obi so and also from child when you have some health challenges from nkrabrema na abottle up na babedruo. So all those things that keep on filling their cups. Major surgeries, injuries, incorrect diagnosis be a demano. Satama no sir, into all this while doing sad problem no heading or into already no on nama or heightened nervous system. Your time into me rush it through everyday adult stress and then no you know juma problems, our problems, relationship problems, moving, divorces, marriage, buying new homes, losing a child. All those experiences, will add up to the nervous system now, sensitive, Then major life events, relationship status, housing, death, and all those finance. All these things, will increase the nerve sensitivity. Then chronic symptoms start coming in. We say, we say yes, shoulder problems, all these things, fatigue. Then gradually, the nerves are learning all these traumatic experiences, and that becomes the default setting of that person. And all it takes, and then they say, this changes the entire brain architecture. And in the brain, he has been traumatized by all these things, all it takes, and they say, Bibi kakrebi, not the problem. Then they start having pain-related stress and changes. Or more physical activity levels, social life, mental health, or more routine activities get affected. Then they start going on the downward spiral of having a chronic pain. And this is another picture just to give you something. Say, Obi we're experiencing pain. There are two paths. Obi or experiencing pain we are going to go through. And me say from middle, the pain experience ain't happening. Some people will have fear. They have no fear. They will confront the problem and they go through recovery. For most people, this is where the problem is. They have the pain experience, maybe on the shoulder, They start going to what we call pain catastrophization. They say, hey, no. And I say, ya only ya reno. Hey, me diabetes, no. Me wo moja bruso, me wo this. It's like most of us, we personalize these sicknesses as if say a japade. So instead of saying baby be a you are taking it as something important in your reaction. Oh, me shoulder, me shoulder, and to wafana ya japade no they afan or they born hosa for him. And to baby anye day, and yam fahona, they be all day, me shoulder, and why me shoulder, me have had shoulder problems since. And they start having the pain catastrophization and then pain-related fear. Then they go through avoidance. But bear in mind, the more na or avoid, the more the tissue na or hormone disuse start coming in. Then the disuse now, and I'm saying disuse woman, the slightest activity or baby say now, first, and I'm so on my answer. So I'm using the shoulder as an example. Because of that, so over the bedroom baby, the shoulder now is frozen. Okay, so man and so say growing to me day. So because every day the tissue now are changing based on that. Now a problem that started as something very small, now it has become very big. To the point to say the shoulder is completely frozen. To the move. Most of us, that's where the problem is. It starts with one back problem. Oh, maybe so, and a problem by now because of that. One baby and did anything better to build back, to go through to say alarm system, to draw it back to the lower level. No, and OTT so and then baby kakrebino, they go back to the main problem because nothing has been done. So I'll use this as an example. First, they start here, pay neighbor, as or take care and omoko merry-go-round. The pain will lead to they lose hope, they have increased fear, they avoid, and then they come back to depression and loss. Into one namsa loop they never get out of it. And these are some of the things that people actually. So people will start having the excuses. My pain is due to the bulging discs. I heard because I have arthritis. Pain means something is wrong. You see, movement will damage and increase my pain. I'm not doing anything until all pain is gone. I'm afraid my pain will get worse. I have a very rare case of. These are some of the things that we hear every single day. And for me, whenever I hear that, I know it's somebody who have had this issue and doesn't want to do anything about it. Wadia to me say, and only any default, and Jonya and I say, obey be found. But that is why getting to know this, it will help. So people start asking, what test, what treatment, how long, what are the precautions I said me here, just to be able to ease off all of this. But near me person me can say, me person me this, in 2 minutes. A lot of times in the issue, and I say the best way to deal with this, and then they say, I call this the circle of tolerance. The biggest challenge I might injuries, and we get into the spiral of chronic pain, and then they say, Memphane said this circle away, your tolerance or cap, no, how big it is. You saying it here. And to me, use the same shoulder, no. Memphane say, I'm what I will show them, to say bottle. That is Nekesi. I want to who show them say it here. Nekesi, no. Most of us, the circle of tolerance now, these are some of the activities I hear. Grocery shopping, walking, housework, gardening, your juma, your climbers, your jogger, playing with our kids. Now, this is it. As far as say what your activities are, it fits into your circle of tolerance. You are okay. Enti ahode a wo nti memfa ne se me show that way ahode a wo mu ne 10 se me ka banku a 2% na me senior ma memfa ne sa eno so 2% me de account 4 me twi mako eno so ye bia 4 na ye den memfa se 8 no aka 2 pe enti memfa se me sensene ba yere eno so 2 me 10 aso meaning says we ye bibi fufuro bia extra. You've exceeded ahode a wo den. I will show them. And most times, what happens is as soon as your activity exceeds your circle of tolerance, problems and injuries start to happen. So what I'm saying is most of us, sometimes we've done too little for too long, or we have done too much too soon. Enti dakro wa ho de wo show da no 10 sa da no nkwa utwi banku wo ye nkwan wo ye we say wo ye wadun so be cake wo ye wadun na won say ya na cake umfa ntwi na wo de yes na wo de enti within a particular short period of time no 10% ahode na nka wo show da no why ye adwuma worth more than 20%. Senke basika In Quebec, say, why then? Why exceed your budget? Into who run it then? Deficit. And in simple put, a lot of times, this is the summation of how people get into those chronic pain. Anytime your activity exceeds your tolerance, or your tolerance falls below your activity, and in monetary terms, in the same Americano, anytime maybe will expenditure bro how much you earn, yes, so you become what? Broke. And I say, anytime maybe your income falls below your expenses, and so over there, you're broke. So that same broke, that is how our tissues respond to. So for most people, the injuries it is not already, yes, the body index in your mother can contribute, but most of us, the problem is say your activity exceeds your tolerance, and now say your tolerance falls below our activity. And it's all because most of us have not done anything to increase our capacity. And it's a main fan say, will expenses exceed will income? You have two options. Either say over there, over pay juma a bit or more, and also be cut down on your what? Your expenses. And I'm a boy. But assuming say will expenses fix that, then what do? Meaning say you need to make more money. And I'm a boy, so that you don't get broke. So for most people, I'll tell us say, a lot of us, and some of the challenges are maintaining climate stress, maintaining your way, is because over time, your tolerance na ayeden akofom, and also your income no acquired akofom, and still like your expenses na increase, and your body cannot take the amount of stress we are putting it through, and that makes the nervous system extra sensitive and is always in chronic pain. That is a long story of it. And things can begin to hurt when these things happen. Me the manu be see, say yemre no koye. Na ya pesi betime nya time ne bi kakra na ye dey answer some questions. Me sure say as the questions goes on, some of the things I yentime account, ye betime account. Onyame kan bon oyishire no mo ye ho ban na dum ti. Amen.
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 What a blessing. What a blessing. What a blessing. Dr. Ben Bediako Opoku Eradinsrao.
Amen.
In fact, I don't know main waste time. If you say be an obi or questions questioner. Mama ye misa doctor. Nafe yentuaso. Lieutenant Colonel Isaac Chum Ampofo.
Yo, doctor. Di kan Onyankopon hyira wo.
Amen.
Onya nimdie bebre. Esan se sade ya wo kire yi. Enke bede ne hu. Enke se ibetua sika ne yakoto. Because de bia meka se onipa je se wuwu a adesua de. Esese brebia yesua de. Now, di kan o starting o throw where's bi go known pain, known gain.
Yes.
Na
No pain, no gain.
Masua de papa me ko to car wo Hamburg, Germany 2001. Na broni bia draw ade to akire macho bi. No throw no, but no wanye no we no pain, no gain.
Yeah, no. Knowledge.
Aka me trimu sa be si na mi be hu ha. Say ye known pain, no gain.
Yes.
Ye to sumienu me ye army officer retired mako training munti physical pain the my experience be papa.
Yeah.
Ye kofofra ye first 2 weeks ye maye nante. You two mirika onahun, but with time though you become adjusted. Ucheche no mai bia na mahu. Ye free bibi ginger legs. Ye say make us we sikura gume. Ube press so ankwa ye be wadi. Pain no be fausa wo de she boot na wo ye say wo ka say wo hospital doctors no be kan wa back say wo nyare. Sa the personal experience me free dance ro omo bodan bi so akura se me kofo ye na me kutodwe yakoye me seje na omu a no mo de yentwa om de pin bia wo mu a me say fluid bi accumulate by yanko omu a na me Philippe inti me de exercise na me ye kakra omu anako omu anaba nti noma wachire ye na die me die ma nya adipa fi mu nti bi da se nya me nhyira o onkoso e ma onim die amen.
Amen. Amen. HF.
Yes, Doctor. Me opinion na me bisa question.
Okay.
Mensa. Eya me yapa maye mara maye straight bia na wo ho na mensa no. Actually na hono. Me kwa na o makodrin ni o say me body ni making more fluid. Enti me bisa doctor ne say eye di enti na my body ni making more fluid. Aduane a me die ana say ye bibi na de saa de ne ba. E na enya de na be gina ho no nko. Mensa na nkasa eya me ya no kura de say de be hono hono say woni ba bi na say woni pain ni mo kura de a. Any problem. Omo twa na ba na o say obetimi ama madru. Adru no so any guarantee 50-50.
Yeah.
And on betimi a surgery. Surgery no kra me schedule but me sa cancel because surgery no so a 50-50. Oh yeah, etimi samba. Enti no me question me bisa on say bibi sa no. Ebia bibi ani ho a obetimi aye ana wonim se etimi ma ebi say body ni making more fluid and now say now can say be a tissue bi and I say and a bass idea now be ya sad no betimi cure without any medicine.
Yeah. That's a powerful question. I think say one say Tina can say initially they can define that some of these things a systemic issue. And yeah, so once the omukra can say 50-50 because the surgery is just cutting the problem, and I say cutting the ability to drain the fluid. But like you asked and you asked the right question, say what is causing the fluid need to be built up? Okay, nipa ni bi wade friend say chronic systemic inflammation. Chronic systemic inflammation happen when like aduane die anyways, and like I said, and you go through and we talk about some of these things. A lot of times, sometimes is you need to like retrace your steps and look at what food and I say nuane be na wudi and I say we see Emma system ni produce more fluid, because naturally, Uber say when you saw sorry one day and I was say a one fluid in it build up. Okay, it started coming up, and we need to take. And one said the unfortunate thing, and then I said, in a part of the world, sometimes the doctors and nurses don't even have time. It's medicine are so commercialized. I used to capture to the and say, it's a senka first on keep your take time. Me senior nurse be an ejuma and then not now no make no case or no cramble as a nurse, when we come now we're talking about like medication reconciliations anyways and all kind of say or no crumbles or call for the PCP if they are having hypertension. Most time their strategy or no the PCP strategy and say okay, you are getting hypertensive. What kind of hypertension about what then is it because arteries in hardening up into my blood pressure and the cholesterol? Then he will try to retrace it and find out why is the arteries in the hardening up until we are hypertensive, And if that is that, I'll say his normal PCP, he spend more time in some of this is money, but the only thing is on a practice, people always have to pay more. So you see the social determinants of health disparity, meaning they can now go to somebody who is more or no best spending more time with them and trying to examine their diet and see what are the activities a bit more causing the arteries to be hardened up, and then start making dietary and then lifestyle changes to change that instead of straight away going into the medication route. But that's what I said. But in these instances, in most of our experiences, your doctors and I said the people we are seeing, we don't have that resource and I said the money for that. And it is up to us for us to also, and maybe we can reach out, like we can talk around it behind the scene. But some of the things, and then they said, you need to take a decisive step and start looking at what are some of the things prior to you start experiencing, what has changed. Sometimes I ask people, what has changed within the past year or two in your normal life? Has there been any major or significant change? Most time, my patient, one of the questions may be so, has there been any significant change in your past year or two Because those things in the influence and the current symptoms now we're experiencing. And one of the things, yes, into no 50-50, you bet my contract once a kennel, I can't be once a fruit do not kind of need anyway. You see, some of these interventions are just a short-term solution for a long-term problem. And you bet my just a short-term other say medication and I say there's some kind of mutual surgery, no more draining. But the problem is that something is causing the fluid need to build up, and I'm here now saying about back into 50-50 no. And let's try to retrace our steps and find out what has been the changes that are happening within the past year or 2 or 3. When you have some systemic chronic inflammation, and you are getting that swelling. One of the reasons why you are even experiencing the pain in some of these things is nerves need 3 things. Let me quickly say that. Nerves need mobility, space, and blood supply. Anytime we are nerve will be impinged, and inflammation is one of the things nerves hate. And anytime you are getting swelling in any place, and the nerves get ramped up. Into I say, "Obi tina play." When I say, "Yes, in 9 go to sleep." Na say 9 etc. Once a Philip Bibia or 9. Yes, na anansi na just order na pem once na head. What's now what you feel a relief? The same thing. And to one side, the same way say swelling sana innovations now or nerves, and we can say 45 miles of nerve. And when they get ramped up. And then into once the fluid do not get drained, and I say it reduces a better nerves now the freedom to move and to have all of those things. So that explains why you're having those chronic pain whenever there's that inflammation. But I think so we need to maybe find out and have a long conversation trying to treat ourselves and find out why did all of a sudden you start experiencing all those inflammatory processes. Yeah.
Okay, the doctor with the message or medical number na me no. I discuss about because maybe be an meeting me I can
yes,
land.
sure, and definitely
Yeah.
I would not even advise that.
Okay.
Okay, Motorola.
Yeah, abusuafoɔ me mama adwo ɛwɔ Ghana. Yɛfrɛ me Osiabo mekasa ɛwɔ Ghana.
Okay.
Ɛyɛ anɔpa nkwante du mmienu abɔ. Kwansifoɔ yɛda mo ase. Mɛtie mu throughout the whole week ni nyinaa.
Amen.
Doctor, my question here.
Okay.
Meaning sɛ ebi a metie ne yi a medical profession for no net say some way or other no more that patients no.
Oh, definitely.
Good.
I'm not gonna excuse that.
Yeah.
Because me kai me mama chiase no na me mama wo sisi yare. E dey no ko hu doctor bi wa Accra. The first first visit no or no panie. I draw the one panie there nam say jamin saka na minimum anything about medical and I say you knowledge be to know. My no ho ye anything. Me mama to me nante that's 2 weeks 3 weeks be.
Yep.
And so you know area no sound by.
Yeah.
After could do pempen so be a me mama wo na say doctor na on the panie. Oh doctor, na dey me buy one on me panie. Me mama ebe nante said den abefie kra na yare no enfo. And so my doctor no twi common nsuo kra ngu syringe mu no mfa ngo no. Me mama nya
ayaresa. Yeah.
In fact, pain. So being called pain more, the all can and I said the Nipana Wako pay more can. One here, Rebecca said, would you all won't quite hire? And to me, Pacho, my question is, France said, me will pay more. No matter hospital, I call doctor. Doctor, I trade drama me. I don't know what trauma me, Benamo and the Bia a cockatra. Me were all right. Send me bisa doctor say. Again, I'm a first swap. Make me pay no bet me a free me move. And I say free me system. Na kwan be so na buy a pay no it me a buy. Because when nipa bebre bi wo hon man, omo pains no buy and na some yare buy. They can't recount and I recollect. Yeah, a kwan fast yare no e buy. And also no e buy any day. Me do ase.
That's it. I know say it's very late in Ghana, but you stayed up to listen to the program the entire week when you shall be praying. And I think it's a part of the question will be sad is even in the response I will use to my mind. Once that one of the things I always say, and I'll be honest here, and then I'm not going to excuse one of the things that you move a we should know is that medicine is business now. Okay, medicine a business. I think so. Be a good woman on turn to man now. Medicine right now is business. In fact, this week I was reading an article. Right now, the dynamics in this country, even in the US, have changed. The major employers in most states, in fact, I'm publishing an article, is now healthcare companies right now. But first, the major employers in every state were industries anyway. See, now it has reversed healthcare. Those are the major employers in most states. Medicine is business. And at every point in time, the orthopedic now no. The first line is about what's a drone or about cortisone injection to numb the pain. One said, Mesha say anything of the can't. Said the first thing mostly is to numb the pain. The pain is just a messenger. And to one says, what can you use my yeah, no. It's just sometimes they say Obi Kwako yes so in pain here when epidural and that's we say is to numb the pain. Okay, so that won't take near to me I say okay surgery. Now you say local anesthesia crana say a small procedure once it me e wo pane wo won't take na when you gusu ni etwa so won't ni aye ya kata so ya after 3 days later anesthesia no we go for half an hour say won't say ade na omo ye the same way, most of these cortisone injections, and in fact, the long-term effect of the cortisone injection is the very cartilages now. Cartilages, and it's like you're robbing Peter to pay Paul. And I say, yes, a 2 hour for failure. Into your one cortisone injection, if you do a so I didn't go on, say, be a quiet surgery, and I say, you could replace it, you say, especially hip replacement, knee replacement, chroma say, that is what happened. The cancer to have for failure and then finally near the Wabani I replace in juice can be not. So one of the things and then I say that is why this program so that you take your own health into your hands. So that you don't get to that point because a lot of times a lot of times the reason why we get to that point now and master some of these chronic issues and they happen is that the very protections I see nearly protect your body, we stop doing it. Into over time, for instance, they say back now, your lower back, most people, the back problem is at the L4, L5, S1 lumbar vertebrae, and the sacral plexus. Most people want a problem. The question maybe on this platform is say, how many of us your platform is to do anything like a back exercise or stretches to strengthen the back muscles?
Doctor, every morning I do it. Just
good.
But once I say yoga, stretching.
Stretching. Once I can say okay. Once anytime you are very active, your pain goes back down. That is it. But you move brain the problem. Then they say per shortcut. You didn't say and once all the pill out to the no and no easy approach. But pill is not going to build up with tissues for you to do the things that you need. Into no pill no manner but a number into say opportunity or and I'm say pain or number pain. The problem are not one as a tissues na say no or nye bibian fa ho nti pain ko pe o ma me so okay no anante so no ye ne opeso ye obi wa obetimi kra de akwa ofuo bi we say what happened and say o say no I say o kai bia engine oil no every and na check engine light better so instead say obema mechanic na fix no o yi check engine light in free so to say mechanic no and I would car na sequence so drive from Accra to Kumasi. And by the time if I cry do Kumasi, meaning says, oh, you know, I cry the woman cry, I really am an iron, asa. But because a checking in light in the air free, so no one you're doing, on to say bedroom been out for the night engine, I send the kojoto. That is where the problem is. Most of us, the very structures that you use your back, your arms, your knee, we have houses that have stairs. Every day we are climbing and going up. Here you see a body need the year. The question I may be saying is, what have you done to strengthen the very structures you are using every day? Most of us, we have back problem, but the question is, how many of us every day dedicate time every day to do back stretches or do strength training to build them up? And my man put it by a man, young man, we are the most guiltiest of it. Even for young people, or you're very active, but yes, to bear in mind, then they say, as we age, we are losing about 5 to 10% of our muscle mass through the process of sarcopenia. And these are some of the things I'm a person say dream. Say I'm building up your body no way say over time it start breaking down fast and easily. And the opinion, that is where the problem is. The other part of your question, yes, you have every right to ask the doctor, no, what are some of the strategies that make me I'm free this long term, You see diabetes and I say hypertension. Sometimes it involves say we change we do and the time we didn't know say difficult. But say actually long-term effect and long-term remediation for the problem. These are some of the routes I say echo. But most of us you're doing a difficult route, so we don't want to do it. We rather want the pills. But the pills, like I was saying, just numb the problem. It doesn't solve the problem. Mama.
Dr. Massam, you see, she see us more carry. I just say, it's a way to say, in Ryan, no cry, ye no crass a queen. And that's our party.
Definitely, most of them. And then I say any healthcare profession go and no say most of the pain medication have serious side effects. In fact, this week most of my patients were hip replacement, knee replacement. I do a lot of rehab for my patient background. And he was like, "What shall I say, man? After knee replacement, man, oxycodone, 5 milligrams, I'll not 10 milligrams. Or shall I say, constipation. So the constipation in any man is two stuffness. Two stuffness, it wasn't working. So no, I shall say, I'm an hallucination, no, Mr. Sano, and a command gabapentin, another high pain, and no say, it was making her have a say, or soon Diana and I'm Spain, or Cohenfa, and I test on hallucination. And because of that into and I'm so on an pain. Like you see, the pain medication is going through all of that. And yes, say taking it for a short term where it's fine, many problem. But you move brain yet the year to your mother, and I'm saying my immediate relief, and my relief kakrape. Instead, say you better take the extra step. When they relieve in the near to me, they are solving the actual deficit now. You want no. Yeah, until say you better say your pain be not and that is where the problem is. So yes, the pain medication was actually supposed to be like a band-aid to actually give you a short-term relief, so that you actually go further to solve the problem. I have to say, but this time round, instead so problem no solution. Say they I won't chance any pan bebre o sika no bi no awde akokɔsɔ so eduru ba bia nipa no wɔntimi nyɛ saa biom ɔbɛbrɛ.
Harriet.
Auntie me dance, doctor me dance pa nyame nhyira. Me pa cho me bisa ne say. Me obi a ka me penantie, me nyatam enante da bia no pa bia me trust me nante be 30 minutes. Ansa na makɔ adwuma. Ne say de abɛyɛ me ne say me nan esi fam free me sebe me nan kokom ne me to ase be ka me nantini. Se me konante a afedi ɛyɛ me ya. But say me nante ya me okay. But the moment I make take walk no me nan be me ya saa. Ya minimum ya so nti me pa cho eno so me exercise bi a metimi aye for me na because me person ka me nante me nije nante no ho but say me ntime me ko nante a me nan no ye me ya dodo ye me ya pa.
Well, by simple description anyways, in most nerve that goes all the way there and then goes into the femoral nerve and then the posterior tibia nerve and it goes all the way there. But there are so many reasons why sometimes we will have that problem. No? Okay. And say if you are getting an irritation and no antenna is meaning say the nerve is getting irritated. Maybe at the back side, we can talk further and find out why is it happening. Sometimes Ruby also is because it's there's too much work on those lower back and it's getting that. So we need to kind of like find strategies of scaling back. You remember, this example says sometimes when the activity exceeds the tolerance, there's always an imbalance. It is sometimes yes, nante every day, but sometimes body also need strength. Okay, when he has strength, so you need to balance off. The walking helps with your cardiorespiratory endurance, but you also need strength training to build them up for you to do the work. And sometimes I even tell people, I said the last I'm about platform on the women ministry for all platforms. Maybe say sometimes you need to have a balanced exercise work. Sometimes maybe I will work on your legs or I will work on your arms so that you give your legs enough room to rest whilst you do that on your arms and then other stretches so that you have an all-rounded approach to your health. But sometimes baby for Kosana, so sometimes these are some of the reasons why you might have that because body is too much. So sometimes sometimes I tell people, okay, on the say we do 30 minutes every day. We can just say, okay, now we have 30 minutes. The next time, what is so not there perform, you do something else. But we can cook around the scenes and then do specific exercises for that nerve irritation that we're experiencing.
Into part in sciatica, no, I know. Bibi do why timid no.
Oh yeah, well, Bibi this one. Yes, there are so many things that you can do to actually help out. But like you kind of there are some stretches, specific nerve mobilizations near the with me a bit easy off the tightness on the sciatic nerve, so that it eases off the irritation that we're experiencing.
And more shoes being so
yes. Because sometimes we can go further and ask about the terrain how was it? So sometimes that all of those things influences the approach and we can talk behind the scenes on all of that.
Emmanuel Boateng. Emmanuel Boateng, with me akasa.
Okay, doctor. Doctor we speech out my come meeting when in an any agent home. Now, my program one name me go to you, me long no. Me call me doctor no person surgery. Now, no, I'm stroke a cram, but me to mama drobi. But I don't know, man, me reading instruction on many in your home. Side effects, no. A dozen, say, I am no ma fa back. Na ajai me kakra fine. Ibu abe 1 week na me no me. So no. Na mtemeza mcheze nka me background na nka wachichiri mu achem say could say o say me surgery no ana bibisa.
Matthew Opani. Yeah, those are the something.
Nti me Rebecca na Dr. Rebecca na ma jo number no. No ma from one day nka ma advice kakra. Is as me advice so ma koye surgery. That's why.
Yeah, the American can say yes. That is understandable. The other thing is a lot of the times, even at camp meeting, I met a lot of people. I can't say sometimes some of the knee problems in Iowa is also because of like the disuse and I said the strength deficit that where your quads and I said your thigh muscles. We have that. So even if you're going to do the surgery, if it is needed for you to do the surgery, you need to build up those tissues. And yes, the surgery, is not going to be successful. Okay. Because at the end of the day, you need the quads, and when they do the surgery now, you need to really build the quads up so that actually you can actually use the knee. So these are some of the things that Ayana people don't know because the things that is just around this. Yes, the joint, is there. You can have problems with it, but the surrounding structures not strong enough. No matter the surgery, you are still gonna have poor outcomes. So one would say, like, it's just the pain. What we're doing now, the pain goes down. Like, it's the same thing we've been talking about. The pain goes down, and then you keep on walking, thinking that everything is okay. But the actual problem that I'm not paying it, you've not done anything around it. Until it's like you are just running in circles. The pain comes, you numb the pain. Now I can know to say me use the example. No, what the plaster no. No, I mean no. Now my sending or sending ya Opoku nearby. And now what the plaster no. After 1 week until can be one or sending ya a queer man who's so on your domebo man is yes car. A queer man who buy 1 week ago also the plaster a tarot no. And also, man, son, but some later said, "Menti kwa ukunka." You see how that is how we work around this. So at the long run, no, my miss will hear no, one found qua, or keep on sending people at every point in time. But most time, until we solve that problem, that is how it's going to be.
Okay, me that's what doctor, me that's pa.
You bet me, I can say, and then we work around that.
Okay, me that's why, me that's.
Okay, so far, your brain unti. A brain copper. Na me gidi se de asemi si hia no. Se ya anakura nka hayen. Na de asem kakra me woka ne se Awurade ehira yen ya na wotwe mu de wo hira ye mroso kra. Enye Dr. Ben asemi nko a de obia ka ne na wotwe mu no. Awurade boa yen ne de ni nyina ka bomu aye adwuma meaning say ye di Awurade asem a waka kire yen ene de onam maame white so aka kire yen no. Se ye keka ni nyina bom na ye de aye adwuma ye benya hoden na ye Awurade aye me gidi ye se enye by chance ena na otwi Awurade nam nadum so hira ye hira ente se Dr. Ben Awurade hira o menim se wo de enya de am de wo namba ma obi ye be ha o na menim se bia wo be ka kire me specific time a omo frɛ wa ha wo na me de namba ne ma omo a na me de no nso aka ho se be ya omo frɛ wo omo benya na nyansa ne nimdi Awurade de adom wo no nso odi bi adom ye nyina Awurade hira se wa fa dwuma se nya doctor ya ye busy enso na otwi mu mama ye hu se onyame ma ehu hia mo eno nti ono so ebeto aso ehira adofonom ene try zoom line eto ochina ye sum wi na health week no etwem na mesre ye nyina ne se Kristo nti moma ye moye homode na ne yate no ye mfanya dwuma na si ye ne saade a se de tie bia no ye nye se de ye tie efise ne bo hye ne se ye tie na sem na ye di ne mra nso a yare a ode gu Misraim force no yen oma ebi emma yen so
Amen.
Awurade se won hu ye mmobo na won to aso nhira doctor fo yi mai na yen so yenye ye fam de no kuremu na yetimi anya hoden na yaso Awurade yi de manu si na yasre ejesi bi se wo mompa ye mai na wo mompa ye nhira a doctor fo yi nyina mai na yen Awurade adumu o ma ya hoden a yebetimi de aye ne ye fam de no kuremu na nani mo nyam adaadi CB radio yedamo ase Trinity Media Awurade nhira obi bia ene yenya ye baaso moma yenyi nhira nsa na yakọ
Yeda wase Nyankopon wo yeyo ede adoye ene enhyira ya ode amaye na otwi mu nyina wonam waduefo so akyerɛkyerɛ yɛn nneɛma bebree na ni nyina mu ne yɛka ne sɛ twedu ampɔn aseda ne yɛyie ene ntontom enka wudini wodi yɛ papa enu nti yɛda wase ebre mu de ne ayɛsrɛ ne sɛ Oma ya umubedi jumedie nimu nyina. A doctor fo na monso edi afutu sema ahodo ma ye nyina. Yesre wishra edi ama umu nyina. Na fe wadom eni ohumobro no. Wamomo akọ omo nim onim di ahodo a odi dum omo no. Sebera yensuso ibenya mu emfaso se ne ne nso. Wona mo akọ Bediako so edi amaye. Enu ti yeso se hira wako ansuma ye.
Amen.
na dwuma ya odi ato no ho so oye no onye mu hunu mu bebre na onfa so emoa wo ma enu nti enwumre ebra ye crowd ne akodi de nso ye nim se ye mu bebre wo ohaw efa pains ho na uradi yankopon bibia ni ho awo ntimi nyo enu nti eja ye sraw ne obetumi aya ma omo be di omo ho no na enwumre ye so se fa dum ma
Amen.
na wadom no mpanimfo akyerɛkyerɛ akwa bebree nyenye sitie nyenye sakraye wo ye nema bebree mu ne nim sɛ yɛyɛ ne saa afei deɛ gidie ne nnwuma no betumi adaadi ne nam saa yɛ so manya ahoɔden de ayi wɔ adwuma yɛkɔdi dɛn yɛsɛ sɛ mmoabɔfoɔ mo yɛ nyinaa ho nsraban hyia no ɔnye yɛn ɛmfiri ɔsɛefoɔ mfidie nyinaa mu ɛnsiesie yɛn ɛma ɔgye da no ɛsiane sɛ yɛbisa wei ne adom bebree wɔyɛ agye nkwapa ɛne awurade yesu kristo di mu sɛ gya wopɛ no ɛno ɛna ma no nyɛ hɔ amen
Amen. Adɔfo no Awurade ahyira yɛn. Sɛ yɛpɛ na yɛtie a yɛbɛdi asase ne so nepa. Ɛno nti me mpaebɔ ne sɛ Awurade nka yɛn ho na nea yɛate ne na awɔtwe mu no yɛn nyinaa yɛmfa nyɛ adwuma na ɛnso aba ɔha ɛne ne mmɔho ma yɛn. Awurade nhyira yɛn nyinaa. Moma yɛmfa asomdwe nkɔ. Ɔkyena wonya ho abra queens na massage, blood pressures, bia any a doctor for mbeba for consultation. So unya ho ba ebe yen nhyira ma ho. Erade enhwe yen nyinaa yeso. Bye bye.